I'm Prashant Kadia, Medical Director of Interventional Endoscopy at Methodist Dallas Medical Center. I just wanted to talk to you a little bit today about the difference between uh, strategies for screening for colon cancer. The two main strategies that really exist out there and becoming the most performed are either a colonoscopy versus a non-invasive stool test called the Cologuard. The Cologuard is a test where a stool sample is provided by a patient and it is tested for amounts of DNA in the stool that may detect cancer or precancerous lesions in the stool itself. So it's a nice test in the sense that it is non-invasive, right? Patients like doing something that's non-invasive. You just provide a stool sample, send it off, and then hopefully give an answer about whether they're at risk for colon cancer or at risk for having precancerous lesions known as polyps. Now, polyps are these growths or bumps that develop in the colon, usually around the age of 45 to 50 in most people, and about 20 to 30% of women and about 30 to 35% of men will have a polyp in their colon by that age. Colonoscopy has been the true test and gold standard for diagnosing polyps and has been shown in studies, prospective studies, to successfully reduce your risk of developing or dying from colon cancer. Very strong studies have shown this, including the National Polyp Study and large cohort studies. What a colonoscopy is a camera that we use while the patient is asleep to look inside the colon directly under visualization, to look through the entire colon and try to identify any polyps that may exist, or God forbid, any cancers that may exist. And if we see a polyp in the colon, we will actually remove it at the time of colonoscopy, and that has been shown to reduce your risk of developing or dying from colon cancer. So a person may ask, well, why should I do a colonoscopy if I have a Cologuard, a non-invasive test where I can just send the stool off and get my answer whether I have a polyp or a cancer there? So that's a very good question. The reason is that these non-invasive assays have been developed over time, and they're getting better and better over time, but they're still not nearly as good at detecting polyps or detecting cancers as colonoscopy. So a Cologuard test will detect cancer in your colon over 90% of the time. So if you got a cancer in there, most likely a Cologuard test will detect your cancer. But that's already a little bit like the horse is out of the barn, right? You don't want to get this test back and say, hey, I have cancer. No, you want to get these tests to prevent cancer. That's the whole point of colon cancer screening, is to detect polyps before they turn into cancer. So by the time that you have cancer, you're done. You're going to have a surgery. You may have to have chemotherapy or whatnot, and you'll have to have intervention to make sure you're cured of cancer. But if you just have polyps, those polyps can be removed via a colonoscopy or whatnot, some type of procedure, and then that's it. You've never actually developed cancer. So I think detecting cancer is one thing, but detecting polyps is another thing. And the Cologuard test can only detect about 42% of all polyps in your colon. So that means that over 60 or 55 to 60% of the time, if you have a polyp in your colon, the Cologuard will not detect it, and you will go on living as if that polyp never exists, but it is in your colon. And the colonoscopy, on the other hand, detects well over 90 to 95% of polyps in your colon if you do a good prep. And so, for me personally, I would not risk myself, being to a stool test that misses around 60% of polyps in the colon, which have the potential to turn into cancer down the road. The other issue with the Cologuard test is that, say if it comes back positive and it does detect a polyp for you, which is a good thing, right? It will say, okay, hey, you have a positive test. What's the next step then? If you have a positive Cologuard test, the next step is that you should go get a colonoscopy, because somebody needs to check your colon to find out what it is that triggered that positivity, whether it's a polyp or a cancer, and you need to have a colonoscopy anyway. And if you do have a positive Cologuard test, your colonoscopy will no longer be a screening colonoscopy, which is covered 100% by almost all insurances and Medicare. It would be a diagnostic colonoscopy, because now we are diagnosing as opposed to screening for colon cancer, and the patient may be hit with a bill for this. And I don't think that a lot of patients know that. So if you get a Cologuard test, it comes back positive, and that triggers you to see a gastroenterologist for a colonoscopy. you will likely be paying something for that colonoscopy, as opposed to if you went to get your colonoscopy as your first line screening test, that would be mostly likely 100% covered and be a free test for you. So those are some pros and benefits of both of these types of screening tests, something very important for people to know, as the risk of colon cancer is significant in this country, and patients need to be screened for it around age 45 to 50. Have a good day. Thank you.